I'm reaching out to our friends and colleagues on the occasion of the International Overdose Awareness Day. While the day provides hope, it also marks a grim reality. Over 100,000 Americans have died of an opioid-related overdose in a 12-month calendar year. And this is driven mostly by fentanyl, which accounts for 70% of these deaths. Now, our association represents over 1,300 opiate treatment programs through our 28 state chapters. There are about 2,000 OTPs in the United States treating 600,000 patients on any given time. We're expanding our treatment system, certainly over the last several years, as more than 300 treatment programs have opened, and now through mobile vans, going to extend the services that OTPs provide. It's important to point out as a public health reality that the naloxone kits are being used to saturate counties and cities throughout the United States. There are resources which will be posted at the end of this message, which can tell people where to get access to these kits and, to some degree, fentanyl test strips. New York and New Jersey have been posting material on media at the forefront of this, but other states are doing this as well, either through SAMHSA-funded initiatives, that's the Substance Abuse and Mental Health Services Administration, or through state grants as well. The other important point is the training of first responders. And these first responders can be health people, emergency room folks, and also private citizens. It's not hard to use these kits, but it's life-saving. Also, it's important to keep in mind that when you reverse the overdose, it's important to stay with the individual, because if they've used an opioid as powerful as fentanyl, they may need another application of naloxone. Mostly important, you have to get to the emergency room. The emergency room personnel will evaluate the individual patient to determine if they need any further care, especially if they may need access to treatment. And that's where our providers come into play, as other health professionals who are treating people with buprenorphine as well. So I want to extend my gratitude to the people who are on the front line, and certainly to help people survive. These are lives that must be saved, and we need to do that. And so we celebrate this, and thank you for all of your help.